So shoulder instability is when the ball and socket aspects of your shoulder joint don't move entirely normally together. That can be either the shoulder pops out of joint or dislocates, or sometimes it can glide or click halfway out and pop back in again. Or sometimes people just experience a lack of confidence in their shoulder because they feel it to be not moving normally. Well, there's lots of different types of shoulder instability, so not all of them will actually require surgery. Sometimes shoulder instability is caused by trauma, where the shoulder pops out of joint and tears a lot of soft tissue and causes damage. And by and large, those people are more likely to benefit from surgery. However, there's other types of people, other types of conditions that lead to shoulder instability, such as problems with how you can balance your shoulder and your scapula, your shoulder blade, and how you move your arm in 3D space, which can make it feel like it clunks out all the time. And those patients, generally speaking, don't require surgery, or some people have got very stretchy skin and other types of collagen in their body, and their shoulder can stretch and pop out. And again, those patients probably can get away without surgery, and we have other means like physiotherapy to try and improve those. So when does a person require, or should they consider shoulder stabilisation? Well, some people after a single dislocation might consider having their shoulder repaired, and particularly those are younger patients, perhaps patients who have contact sports or high level of sporting activity. Certainly people who have had multiple dislocations should certainly consider surgery, or people who have tried to manage their shoulder instability without surgery via physiotherapy and shoulder retraining. If despite a period of non-operative management they still are not happy with the shoulder, then it'd be reasonable for those people to consider shoulder stabilisation surgery. Shoulder stabilisation has evolved quite a lot over the last few decades. We've moved from open procedures to keyhole surgery. Most of the keyhole surgery is about repairing the tiny bits of tissue that have been torn off from the shoulder. Classically, that's the soft tissue bumper that surrounds the socket of your shoulder joint, called your labrum. We can reattach that. Sometimes we fill out dents in the back of your in the back of the humerus. Sometimes we need to replace areas of bone with other pieces of bone from elsewhere in your shoulder, or sometimes donated pieces of bone. The rehabilitation after an operation is quite a bespoke process and depends on the patient, their activities, and what type of surgery they've had. Typically, though, most people will have a short period of time in a sling, usually a small number of weeks, and then once their wounds have healed and things have started to settle, we'll gradually build up activity. That's usually getting simple arm movements, and then maybe getting back to driving, then getting back to office-based level activities, hopefully with a return to sport within a small number of months.